time. Good evening, everyone, and welcome to today's wonderful evening. Muhammad, Salman, and many more who are all online every day evening at 6 p.m. We all meet. You take around 50 questions as a quiz challenge. Following that, you have Dr. Murali Bharadwaz all yours, and then we will have a wonderful discussion. So please inform your classmates that the live class has started. Yes. So preventive medicine, as usual, is very sleep promoting medicine, SPM. Sometimes it looks very boring to prepare for this exam, but when you take the NEET PG FMGE, if you ask me, what is the most scoring subject? Undoubtedly, that would be the preventive medicine, is what I want to underscore to all of you. Good to see Vivek Kumar, Dhanalakshmi, and many more. Please invite your other friends also. Residents of 3 villages with 3 different types of water supply were asked to participate in a study to identify the cholera carriers. So, the proportion of the residents in each village who were carriers was computed and compared. What type of study is this? You are trying to address a grand population in one snapshot. That is called cross-sectional. Whereas like a movie, if you are following a population or a period of time, that becomes the longitudinal study, is what you have to emphatically remember. What is the analytical study where population is the unit of study? So you have to be very sure on these definitions, doctor. Ecological study, population is the unit of study. Now what are the various types of epidemiological studies that you know? Non-experimental, experimental. Non-experimental are also called observational. Observational can be population-based or individual-based. Population-based can be descriptive, like a health survey, or it can be analytical, then you call it as ecological study. Then it can be individual-based, it can be descriptive with case reports, case studies, or it can be analytical, like cross-sectional or a prevalence study or a case control study. Then what are the experimental or interventional studies? They can be randomized, non-randomized. Randomized can be a controlled trial, randomized controlled trial, RCT, or it can be a quasi-experimental field trial or a community trial. That's what you need to remember. Now, one of the favorite questions asked in the exam is, what is the unit of study? You have to be 100% sure on what is the unit of study. The unit of study can be population or it can be individuals. If you take the cross-section study, case control study, cohort study, it is the individuals who are the unit, whereas an ecological study, which is used to do the correlation, populations are the unit of study. So this is one of the favorite MCQ. Cross-sectional study, one full cross-section ले लिया उसमें all the cases, new cases देख लिया, you are able to calculate prevalence. Case control is used for case reference, cohort for the follow-up. Then in the randomized control trials, you have the patients and healthy people who are being compared. And in the case of the community trials, the unit of population is the communities, is what you have to basically remember. Evidence-based medicine. Today we are all living in the world of evidence-based medicine. Right, Doc? So, what is the purpose of it? Basically, the evidence which is gained from the scientific method to clinical decision making. So, the best available evidence. कुछ लोग बोल रहे हैं कि नींबू का पानी पियो भैया, कोरोना कम होगा. कोई बोल रहे हैं कि गर्म पानी ले लो, कम होगा. कोई बोल रहा है हाइड्रोक्सीक्लोरोक्विन यस ले लो. क्या सच्चा है क्या झूठा है ऊपर वाले को ही मालूम है when it comes to virology. So doctor, evidence based from the scientific method. Similarly, the research paper is investigated by the tools quoted in the research paper itself to check the validity. And the opinions of the medical professionals, researchers, they are all given least importance. So you need to, there is always a very famous saying, please remember in life. Exceptional claims require exceptional evidence. It's a very famous saying. कोई बोल रहा है, फेंक रहा है, भाई मैं हॉरिज़ॉन 3 बार पढ़ा, 4 बार पढ़ा. टेंशन न को लेना. कल के एग्जाम के लिए exceptional claims require exceptional evidence is what you need to remember. The natural history of the disease can only be known over a period of time if you are following how the thing is progressing. That is what a longitudinal study will be doing. The cause to the effect typically happens in cohort, case control, randomized control trial, but not in ecological study, because it is not the individual, but the population is the one which is the unit of study, is what you need to understand. So is the father of evidence-based medicine. Sackett is the father of evidence-based medicine. So this man is the great Mr. Sackett. So he is the one who said, इधर उधर कहानी को सुन के ट्रीटमेंट रखो देना भैया, randomized control trial करो, level of evidence को discover करो. Higher the level of evidence, you try to base your treatment based on that principle. Steroid देना या नहीं देना, कोरोना में. You need to do a study in order to get the evidence-based guidelines, is what you need to understand. Hypothesis. Basically, a variable which has to be tested. You need to enunciate a hypothesis. To study the distribution of the disease in the human population and identifying the characters with which the disease is associated. कोरोना आ गया तो बॉडी पेन्स होगा, कोरोना आ गया तो सोर थ्रोट होगा, कोरोना आ गया तो फेटिगेबिलिटी होगा. इसको क्या बोलते हैं? इसको बोलते हैं डिस्क्रिप्टिव एपिडेमियोलॉजी, is what you need to remember. So what is the best study of first choice for the assessment of an unknown or a new disease with no etiological hypothesis. Suddenly the entire village are becoming, their bones are becoming brittle. You don't know what is the reason. Is it a pollutant? Is it any infection that is causing that? So in all such studies, first thing you need to do is you need to describe the characteristics of the disease. So for an unknown or a new disease with no etiological hypothesis, whether it's viral, bacterial, whatever it is, you need to do a descriptive epidemiology is what you need to remember. About the prevalence and the incidence. Incidence is a rate. Rate का मतलब है denominator में time होता है. But prevalence is a proportion. So we use the word prevalence rate, but prevalence is a proportion, honestly, is what you need to remember. So incidence rate is the number of new cases occurring in a defined population during a specified time period. That's what you need to remember. So prevalence is incidence into duration of the disease. So prevalence, honestly, is not a rate. There are two types of prevalence called point prevalence that measures the frequency of all the current events at a given instant of time. Whereas the period prevalence measures the frequency of the current events, including old and also the new for a prescribed period of time. That's what you need to appreciate. So prevalence is a proportion, prevalence is not a rate, prevalence is a proportion. So tomorrow when you go to the exam, Dr. Murali Bharadwaz के साथ 2000 MCQs खत्म करो. Preventive medicine में topic wise classified. 40 घंटे लगेगा, कोई बात नहीं, मगर ये 40 घंटे आपके लिए बहुत महत्वपूर्ण होगा क्योंकि कल के एग्जाम में 25 MCQs come from preventive medicine. The time you are investing in mastering this 40 hours with Dr. Murali Bharadwaz and mastering the 2000 questions in the next 20 days is going to be fruitful, worthwhile for you to back those 25 MCQs. Now the incidence of the disease in a population of 30,000 and 300 new cases is how much? Obviously it is 300 by 30,000. 3 ones are 3, that becomes 10 per 1,000. So what is the denominator if you want to calculate the incidence? Abhi dekha na, population at the risk is the denominator. What's the denominator, doctor? Population at risk during that particular period is called denominator. Is the denominator. So what is a ratio? Numerator is not a component of denominator. That is the ratio. Numerator and denominator are not related values. Then you call ratio. And it is expressed as a number. Ratio is a scalar, not a vector. So it is a number, is what you have to remember. Now about the prevalence. Prevalence is incidence into duration. So the more the duration, the more become the prevalence. That is what you have to remember. अभी आ गया भैया डेथ सर्टिफिकेट. अगर डेथ सर्टिफिकेट के बारे में सही तरफ नहीं पढ़े तो कल के एग्जाम में जिंदा नहीं रहेंगे हम. It is a prescription to die in the exam after the results come. So what is a death certificate? The main underlying cause of the disease, it is recorded on the line 1C, is what you need to remember. So immediate cause, for example, immediate cause होता है cardiopulmonary arrest. Now what is leading to that? It is the sepsis. Why the sepsis is due to? acute bacterial pneumonia. And why acute bacterial pneumonia? Because of the multiple sclerosis. So this is how you need to remember. Now, what is a standardized mortality ratio, SMR? It is a kind of direct standardization is wrong because it is an example of a indirect standardization. So standardized mortality ratio भैया SMR होता है observed deaths divided by expected deaths into 100. कोरोना के वजह से आपने सोचा कि चाइना में ऐसा हुआ इसलिए इंडिया में क्या होगा बोल के एक एक्सपेक्टेड डेथ रेट है, मगर ऑब्जर्व्ड डेथ रेट डिफरेंट है बिकॉज चाइना होता है, भारत होता है. सो इट इज द ऑब्जर्व्ड डेथ्स बाय एक्सपेक्टेड डेथ्स इनटू 100. पर ऐसा काइकु होता है बोले तो चाइना के एज पॉपुलेशन, भारत के एज पॉपुलेशन अलग अलग है. That is the reason standardized mortality ratio is being calculated in order to compensate for the difference in the age structure of two different populations is what you need to remember. And it can be used for disease as event of occurrence. So the simplest and most useful method of indirect standardization होता है standardized mortality ratio. So the ratio of total number of deaths that occur in a study group to the number of deaths that would have been expected to occur if that study group have experienced the death rates of a standard population. This ratio एक्सपेक्टेड डेथ्स है, स्टैंडर्ड पॉपुलेशन एक ले लिया तो स्टैंडर्ड पॉपुलेशन में होने वाला डेथ्स है एक्सपेक्टेड डेथ्स. सो ऑब्जर्व्ड डेथ्स डिवाइडेड बाय एक्सपेक्टेड डेथ्स इनटू 100 will give you the standardized mortality ratio is what you need to remember. So you have to be very sure, doctor, what is direct standardization and indirect standardization. So typically, if you look at the standardized mortality ratio is indirect. But what do you mean by direct? So you will look at the age adjusted death rate in town B. If you adjust it to the age adjusted death rate, if you apply, that becomes the direct standardization. If you want to know how good is the standard of therapy, for example, breast carcinoma patients, do you want to give anthracycline regime or you want to give platinum regime? How can you be able to compare, is this good or is this good? It is the survival rate which is considered to be the yardstick of assessment is what you have to remember. Now, direct standardization में क्या चाहिए आपको? अगर आप direct standardization करना चाहे तो you require standard population and a population that is comparable to the standard population, and then you compare the two populations. That is direct standardization. So if the rate adjusted to allow for the age distribution difference in two populations, that is indirect standardization. Indirect is a SMR, standardized mortality ratio is indirect. Standardized mortality ratio is age adjusted. These are the two buzzwords which you should not forget. Now, the childhood mortality rate in India. So you should remember, Almost 2/3 of the infant mortality rate, it occurs in the neonatal period. Almost 2/3 under 5 mortality occurs in the first year of life. About 1 in 10 children die before they reach the age of 5 years. They're all the important points about under 5 mortality rate. Now, if you want to compare between two populations and their death rates, it is the standardized mortality ratio. When do you want to calculate the crude death rate? Typically, it is the 1st of July. 1st of July. July is also the time where you get the doctor's day, no? So all crude death rate will be calculated before it. Now, what are the indicators of mortality? Case fatality, life expectancy, standard death rate, ये सब मृत्यु के बारे में बात कर रहे हैं. Now there is an outbreak of cholera in a village of 2,000 population. 20 cases have occurred, but 5 died. So what is the case fatality? Obviously, this 5 by 20, which is equal to 25%, is what you need to remember. So about the standardization, it will allow the comparison to be made between two different populations. For the direct standardization, age-specific rates of the study population are applied to that of the standard population. And in the indirect standardization, age-specific rates of the standard population are applied to the study population. Study को standard को लगाओ, study को standard को लगाओ, वो बन जाएगा डायरेक्ट. इस स्टैंडर्ड को स्टडी को लगाओ, वो बन जाएगा इनडायरेक्ट. बराबर? You will remember this. So स्टडी को स्टैंडर्ड को लगाओ, डायरेक्ट बनेगा. स्टैंडर्ड को स्टडी पर लगाओ, इनडायरेक्ट बनेगा. So that's the point you need to appreciate. Can the online students can punch? Whether the voice is loud and clear for all of you, can you please punch? Now, direct standardization is used to compare the mortality rates between two countries. Why? If you can recall, study को standard को study population का death rates को, thank you Dana. So study को standard population को apply करे तो direct, standard को study के ऊपर लगाए तो indirect. You can't forget. Now, direct standardization is used to compare the mortality rates between two countries. Why? Because of the difference in age distribution. If there is any acute illness, what is the best indicator of the severity? How do you say corona is very acute? If the case fatality rate, which is an important indicator. Maximum power of destruction of the disease is known by case fatality. So these are all very standard questions, doctor. Without any second thinking, you should answer. Very good to see Neelu, Sweetie, Dhana, Vivek, many more. If you are estimating the burden of the particular disease in a community, how do you measure it? Proportional mortality rate. So if you want to know whether because of the blood pressure or heart attack or stroke or multiple sclerosis or Parkinsonism or dementia, why people are dying. So it is the deaths from a given cause of in a specified period of time divided by the total deaths in the same period per 100 will give you the proportionate mortality rate. This is what you need to remember. So doctor, we are building a tradition. Every day, most likely 6 p.m. कभी-कभी मैं लेट हो जाता हूं, but 6 p.m. every day evening. You have a 50 MCQ quiz. फटाफट आंसर करो 20 मिनट में. Then you have a 1 hour chatpata discussion with Dr. Murali Bharadwaz. So, Monday to Saturday, please tell all your friends to join. Then every Sunday we have a grand test. And the grand test of 300 questions is divided into 6 parts of 50 questions each. Ideally, in the afternoon, sometime at around 2 o'clock, we will try to take it up like a quiz. So we will try to take some opportunity that within week the grand test discussion is also being done. So that way 2 times I will be meeting you every day, evening on one particular subject and afternoon, and you have 3,000 hours of video lectures, PowerPoints, full-scale grand test, everything on the online mbbs.com video library. So case fatality rate is a measure of virulence. Case fatality rate is the time interval is not specified. And particular influenza virus will be very severe and kill everybody, and another influenza can be very milder in case fatality. And it is case fatality is more often applied for the acute, subacute illness, but not chronic disorders. Now, direct standardization is used to measure and compare. Why do you do direct standardization? Age distribution को compare करने के लिए. If 2 countries have 2 different age distributions is what you need to remember. For acute illness, virulence is assessed by the case fatality rate. Standardization of a standardized mortality ratio rate is basically for the age. Direct standardization is used to compare the mortality rate between 2 countries. Once more, because of age distribution differences. Proportional mortality rate is basically not a rate, but it is a proportion. Sullivan's index, life expectancy free of disability. With regard to the standardized mortality rate, 2 populations can be compared. It removes the confounding effect of the different age group. The age, sex, race, adjusted rate, it can be obtained. They're all the true statements. Specific death rates, it can be because of any specific disease or a specific cause. It can be specific for age and sex. It can identify a particular group or a group at a risk so that you can take a preventive action. So that's the idea. The burden of the disease in a community, इसको बोलते हैं proportional mortality rate. The killing power, मृत्यु को लाने power of the disease. The killing power of a disease with no time interval, that defines the case fatality rate. This adjective, no time interval, that is what will be emphasized in tomorrow's exam. Severity of the disease, how do you assess? You assess it by the case fatality rate. Case fatality is the killing power of the disease. Sullivan's index is the disability rate, and the health status of 2 populations is best compared by the standardized mortality. So there are some repetitions of the questions. I want to not remove them. If you look at the past 15 years, AIMS, All India, PGI, JIPMA, DNB, FMGE, all these exams, maximum 2000 questions, you need to do a quick revision in about 30-40 hours. That's all. And in the process, you will be having some twisting questions, twiddling questions, some logical list to remember. But you need to prepare your own quick 200 pages notebook, like a ammunition kit before exam, so that the tricky point which we will be having in the discussion, during discussion I will be emphasizing, you need to make a note of that and do the last moment revision. Got it? So doctor, if a new effective treatment is initiated and all other factors remain the same, what will happen? If a new effective treatment is initiated, because of that, the duration of the disease became decreased. So prevalence will decrease, but incidence will not change, because incidence is all about the new cases. And this effective treatment is after new cases are diagnosed, your treatment shortened the duration. So effective treatment decreases the prevalence, but no change in the incidence. That's what you need to remember. The last question for the evening: improved prevention of a acute non-fatal disease. What will it do? It will decrease the incidence. So prevention decreases incidence, treatment, effective treatment decrease the prevalence is what you need to remember. Shweta Reddy, always with a lot of adoration and good compliments that makes the teacher really feel happy and proud. So sir went to the Parkinsonism topic in video library. Very nice lecture. Thank you all. So once more, doctor, tomorrow afternoon, actually today afternoon I could not, tomorrow afternoon we will have a full-scale grand test part 2 as a last Sunday जो भी full-scale grand test हुआ उसका discussion करेंगे. और कल के शाम और एक बार 6 बजे को Dr. Murali Bharadwaz, Sleep Promoting Medicine Like a Lullaby. Let us do the revision. Till then, keep reading, keep reading, keep reading. You may listen a lot of stories about this is good strategy, that is good strategy, blah, 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 blah. But the only strategy, doctor, is you. Are you preparing well? Are you finishing those 30,000 MCQs? Are you ready and equipped with those 953 topics? So each of our session should inspire you to go back to the online mbbs.com video library and do the revision. And I'm here to inspire you every day. But it is you who have to fight the battle, win the battle, and for that, you need to make a promise to your own consciousness that I am going to master and conquer all these 30,000 MCQs on the online mbbs.com video library and go for the exam confidently, without any fear, with the head held high. I am going to attack the exam paper. That is what you should remember. Shortly next week, we are coming up with Incus quiz app. Every day 10 quizzes, each 15 questions, 6 to 7 minutes of tournament, and you are revising along with all your crowd of friends, knowing who is answering above you, below you, above you, below you on the Incus quiz app. And every month you have 300 quizzes to play and keep you on with full energy to become a winner. Keep waiting. The moment the Incus quiz app is on the in the Play Store, I'll give an update to all of you. So see you all tomorrow. Bye-bye.